Now, on today's edition of Be the Expert, presented by Hartford Healthcare, we're getting you the latest information on the COVID-19 vaccine rollout. Here's Keith Grant, System Director of Infection Prevention. What's the status of the vaccines and how many has Hartford Healthcare administered so far?
So far we've delivered 196,000, which include 122,000 for first dosage and about 74,000, a little bit over 74,000 for second doses. Obviously, we've added the Johnson & Johnson vaccine, so there's no need for second dose, and we're monitoring that as well.
Headway is being made in the underserved communities. Tell us about what's happening there and where and how you are getting vaccines to people.
Yeah, so, one of the commitments that we have in this entire process is to ensure that we're reaching everyone with information. And I do believe, Liani from the governor's office, from the mayor's office, speak about not hesitancy per se, but whether or not there's proper education being delivered to these communities. So we're working with a number of groups to ensure that that's happening. And we're also realizing that needing to go very specific, potentially on the individual level to help with scheduling. So versus getting 1,000 people at a clinic or 500, we're having to facilitate singular people or singular communities. So there's significant headways, but it's effort from a number of people, not just the health system.
Hartford Healthcare is offering something unique. You're actually giving people a choice when it comes to selecting a vaccine. How does that work?
Yeah, so when you do sign up, you have an option between Pfizer and Moderna or Johnson & Johnson. This is consistent with the Hartford Healthcare values in that, we try to make things accessible and we try to ensure that individuals have choices. And it was very difficult to step away from that, right? I think this is the right thing to do for our patients and for this effort.
What advice would you give to someone who is still skeptical about receiving the vaccine?
There's so many resources. There's so much information out right now. So when this started, one of the things we said is get educated about it, get information. But there's so many places to get information. We go to the CDC for our information. Some of that document is kind of complicated. So we've filtered that out, and that's on our website. The Connecticut DPH has a number of information as well. All the other health systems have information as well. So get educated, pass on the information as much as possible. Keep in mind the things that got us to the place we are right now is the very simple things: hand hygiene, wearing your mask, social and physical distancing, getting tested if you're symptomatic. Please don't change those things whether or not you get vaccinated. I know the CDC came out with new guidelines. Be aware of your surroundings and your symptoms. And again, vaccine education and passing it on. So we're having community conversation with individuals at this point in time. The initial approach was a broader conversation. So we're having conversations using the resources we have in the communities on the individual basis, and it's helping a lot.
For more information, go to hartfordhealthcare.org/coronavirus. Coming up.